It was kind of a fluke, I think, that I came to work for the World Health Organization. As I look back at it, I joined a multidisciplinary research division, and they were recruiting people from a lot of different backgrounds: epidemiology, mathematicians, statisticians, geography, sociologists, all kinds of folks. And the thing that I became impressed with was that healthcare and the disparities of healthcare had so much to do with poverty, with the access to healthcare, with resources, with finances. And I'm a person of faith who has to look at these things and filter them through, make them a part of my worldview. We are to be about justice, and the lack of justice in healthcare is really one of the critical things within the United States, because the United States doesn't, frankly, regard healthcare as a right. It's a commodity. I'm Jerry Stromberg. I work for the World Health Organization. I became the director of the organization Christian Community Health Fellowship for 6 years, and then I retired. I think if we really regarded our quest for healthcare in the United States as being something that we wanted to put the best minds to, and the first things we would think about then would not be profit. We have an excellent healthcare system if you can pay for it. But the kind of outcomes that we get, which place the United States so low relative to other industrialized countries, are because we have such a diversion of resources and access to health care. If we really intended for people to receive adequate health care, we'd say, well, we have to do something here to make this more equitable. And that would probably be one version or another of universal health care. The healthcare reform bill that was finally passed is very, very modest. It's been described as pretty much what the Republicans had promoted in opposition to the Hillary Clinton and Bill Clinton kind of proposals back in the 90s. So it's hardly a radical perspective. I mean, there's still too many concessions to insurance companies, but it's also pharmaceutical companies, it's hospitals, there's some very, very strong, big interests in the United States. And that we really do need to see that what we're looking at are products of a system. They're not just individual choices. I mean, we like to blame individuals for what happens, and we like to blame sick people and poor people. It's about individual choices. That's how you end up in the kind of situation. And I'm wealthy and I'm doing well because I made good choices and I worked hard. And you're poor and you live in a crummy community because you made bad choices. It doesn't work that way. Cornel West says justice is what love looks like in public. And so I understand that justice is a really key component of my faith. And when I apply it, it means, well, we have to address some of these inequities, disparities, whatever you want to call it. Now that gets to be very, very political, and I'm not very optimistic about our current situation, but I will keep on struggling for that.